Good morning, everybody. This is Erik Daly from Miller Johnson. Thank you for joining us today. I'm here with my partner, Tim Gutwald, who is a partner of mine and also chairs Miller Johnson's Healthcare Providers Practice Group. Today's topic will be the CARES Act for healthcare providers. So we'll be focusing on those provisions of the recently enacted CARES Act that are most relevant for healthcare providers of various sizes and various types. Before we jump into the substance of the program today, we always begin our morning webinars by taking a quick look at kind of recent developments, both globally and more locally. Briefly, yesterday's developments are largely not positive, but I think expected for the most part. Globally, coronavirus cases are now over 1.4 million diagnosed. Michigan, more locally, where we are, has confirmed over 20,000 cases. And because of the number of people who are seeking treatment, and the limited number of frontline workers to treat those patients, the CDC has issued new back-to-work guidelines to relax the required 14-day quarantine or distancing period for essential frontline workers. And today it's anticipated that Governor Whitmer will announce an extension here in Michigan to our stay-at-home order. She has confirmed that that will happen, and I think there are just questions about the details at this point. And obviously we continue to track those developments here at Miller Johnson. So notwithstanding all those unfavorable developments, I think there's still a sense of optimism and sort of starting to see some light at the end of the tunnel, hopefully. And throughout this turbulent experience, our attitude and approach at Miller Johnson has been informed by our principles of bringing ingenuity, collaboration, candor, loyalty, and intellect to our partnerships with clients and the community and other professionals. And so we continue to bring that spirit to what we're doing, both through the webinars and our day-to-day client work as well. So we hope you'll take that away from today's presentation. So with that, why don't we move into the actual substance of today's discussion? You see our agenda. I will very briefly talk about the Paycheck Protection Program, which is not really a healthcare provider specific provision of the CARES Act, but it is something that is available to healthcare providers. And then Tim will address Medicare Advanced and Accelerated Payment Program, Public Health and Social Services Emergency Fund, some other CARES Act provisions and considerations. So I'll address the Paycheck Protection Program first. Again, very briefly, because this topic is one that we've covered through several other webinars that can be viewed on our Miller Johnson coronavirus resource webpage. And I think the webinars you want to look for if you want more details are the ones titled CARES Act by the Numbers. And there are two of those. Each of those would be relevant for more detail on Paycheck Protection Program issues, and then another one dealing with affiliation. So if you have multiple entities or controlled groups of businesses, how you would deal with those affiliation issues. There's a third webinar related to that. So I won't get into a ton of detail, and it's a very complex program, but at a big picture level, conceptual overview, this is a $349 billion program, and it may soon be a $600 billion program because Majority Leader McConnell in the Senate is reportedly going to be seeking unanimous consent from the Senate and then presumably to ask, then send over to the House request to approve $250 billion more in funding for this program. But basically, this is a $349 billion program, potentially a $600 billion program that provides loans to small businesses, and that's generally going to be businesses that employ fewer than 500 employees, although there are exceptions to that for different types of businesses and different small business concerns. So even if you have more than 500 employees, it's possible you could still qualify for the PPP. Even businesses with as many as 1,500 employees can sometimes qualify. So if you have 1,500 employees or fewer, or you otherwise consider yourself a small business for some reason, it may be worth just confirming whether you somehow fit into this program, because the most attractive part of the PPP is that the loans can be wholly or partially forgiven to the extent that they are used in the 8-week period after they are funded largely for payroll costs. At least 75% of the loan needs to be used to fund payroll costs, but other forgivable uses include things like existing rent payment obligations, existing mortgage interest payment obligations, and utility payment obligations that are payable during that 8-week period. And you can leave the loan out longer than 8 weeks. You can leave it out for up to 2 years, but it's only that first 8 weeks of spending on those items that would be forgivable. And again, this is all addressed in more detail in some of our earlier presentations and webinars. But the idea of this program is to support cash flow to cover payroll costs and keep up with some of those other types of expenses during, well, at the time that the CARES Act was signed, which was at the end of March, it was during that for an 8-week period. We'll see if that ends up getting expanded if things carry on longer and they increase the size of the program. But this is a program that's also available to not-for-profits that are organized as 501c3s, or if there are certain veterans not-for-profit organizations that may be eligible. Normally, Small Business Administration loans are not available to not-for-profits, but the Paycheck Protection Program is. And as long as funds are available, these loans will be theoretically available through June 30th of this year, although, again, that will depend on the level of available funding that's remaining. And I would say that you may have read about this in the news because the PPP was rolled out very quickly. And banks have been accepting applications from small businesses. A lot of reports say that many of the loans have not been funded yet. So this is a program where you want to reach out to your bank or credit union to try to see if you're eligible, get approval sooner, so that hopefully you can get your loan funded, because it seems like at this point there are pretty significant lags between submitting applications, getting it processed and approved, and then ultimately getting it funded. So if this is something that you think you might be eligible for, it's worth a call to your bank, although I know the banks are also overwhelmed by the number of applications that they are receiving for this particular program, and some banks have actually had to kind of hit pause on their ability to process applications. So I think I'll leave it there for the Paycheck Protection Program. We could and have done other webinars solely on this topic, and we could talk about it for hours. So I guess if you haven't learned about this program already, I'd encourage you to consider it if you're a small, quote unquote, small practice or a small organization. And we're obviously happy to discuss questions that you may have about eligibility, and you can reach out to me, Erik Daly, or your other Miller Johnson attorney contacts if you have questions, and they will direct you to me or somebody else who's familiar with this program to help you understand if you might qualify, and if you do, how to implement it. So with that, I'll turn it over to Tim, who is more familiar with some of the mechanisms in the CARES Act that may also provide an avenue of relief for healthcare providers and organizations outside of the more generally available Paycheck Protection Program. Tim?
All right, thank you very much, Erik. As you said, I encourage people to reach out to Erik or your other Miller Johnson contacts to get answers on the PPP, or to check out some of the alerts and other webinars that we've done on the topic. I'm going to discuss a couple different programs that were included as part of the CARES Act. It's a over 800-page document, and there's a number of provisions that have impact and can help healthcare providers financially to weather some of the storm, and to assist those who are busy, and to help those who have had a loss of revenue as a result of having to shut down and not being able to perform elective procedures. So, Jeff, you can move to the next slide. So first, we're talking about the Medicare Advanced Payment Program. This is actually a pre-existing program that has been expanded as part of the CARES Act and also by CMS. It was previously only available to hospitals. I'm sure you're all at 8 in the morning extremely interested in a vast legislative history about the program, but we'll just focus on how it can help you today. So effectively, it is an interest-free loan or cash advance for 4 months, which is obviously appealing to many providers. The eligibility is extremely broad. It's for anyone that's enrolled in Medicare who is also billed in the last 180 days. You must not be in bankruptcy. You must not be under investigation. And don't read investigation too broadly. It's, for example, program integrity investigations. And also, you must not have sort of past due Medicare overpayments that are that you have failed to reimburse Medicare for. So the majority of people will be eligible for these advanced payment program. So then it becomes, the next question is, what is the amount of loan? How much can I get? So it depends on the type of provider. I know we have people who on the call today or on the webinar today from all sorts of different healthcare providers. So with respect to physicians, it's up to 100% of the last 3 months. The form from WPS, Wisconsin Physician Services, they are the Medicare Administrative Contractor for Part A, which is the hospitals, and Part B, which is physicians here in Michigan. If you're from another state other than Michigan, we can help you make sure you get a hold of the right MAC, but you're almost assuredly quite familiar with the MAC that is responsible for your Medicare payments. WPS has said that they're going to do 80% of the last 3 months of claims for physicians. For hospitals, it's up to 100% of the last 6 months of claims, and for critical access hospitals, it's up to 125% of last 6 months of claims. So we've also been informed that the way CMS is handling this is that they have informed the MACs what each provider is eligible for. So while there's the WPS form, if you go online and look at it, it's very simple, very straightforward. There's a line for how much you would like. If you put more than what you're entitled to, you're going to get less than that. So the MACs are aware of how much they're allowed to provide to each different provider. One thing I want to also mention with respect to eligibility, the way this is tied, if you are a physician or other healthcare providers, is more relevant to physicians, is that when you're going to be filling out these applications, it's tied to your NPI number. So if you have 4 physicians in your practice, each physician would fill it out under their NPI number, and each physician would be entitled to that 80% or 100% or whatever WPS is currently doing for each of the last 3 months of claims. And if you're a hospital, health system, or other entity that has multiple NPI numbers, each facility or these different providers are going to have to send different applications for each of the NPIs, and that's how they're going to calculate how much everybody is entitled to. So it could be a fair amount of form filling for some of our clients, but that's how they're able to determine how much each each person is entitled to, and that's also how they're going to pay out the money, as we'll get to in a minute here. One thing I do also want to mention that's quite important is that you can still bill and collect in the interim, as we'll just talk about the next page. They begin recoupment after a certain period of time, but once you get your money, you can continue to bill. Hopefully you're able to do so despite the various restrictions on businesses at this point. And you can continue to bill and collect on claims. Medicare will continue to pay on those claims during the interim, so you should absolutely continue to do so to the extent that you're available. Jeff, you can move to the next slide. So again, as I mentioned, moving on to recoupment. The recoupment is all the same timeline for each of the types of entities, but the exact when repayment must occur is a little bit different for everyone. So for physicians, hospitals, critical access hospitals, recoupment will begin on day 120. And I should say, I keep talking about physicians, but obviously there's other types of providers that are permitted to bill Medicare as well. I'm kind of grouping them all in with physicians. You know, NPs, PAs are going to have their own individual NPI number, and they would also be eligible for this sort of program. The same would be true of dentists or podiatrists or any other number of providers that are able to directly bill Medicare. DME suppliers, again, there's basically anyone with a Medicare enrolled that is enrolled in Medicare would be eligible for these, but I'm kind of using these as broad catch-all terms. So again, with each of these, recoupment begins on day 120. So you'll get your money, within 7 days of filing your application. The money will come in, and that's when the clock starts ticking. Once recoupment begins on day 120, so what will happen is as you bill claims, you just will not get paid on some of the claims. The MAC will recoup that money similar to how they do on overpayments in many situations. People on the call are probably likely quite familiar with the recoupment process. For physicians, that recoupment will begin on day 120 and it will continue until day 210. At that point, if the advance payment or the accelerated payment amount has not been fully recouped, you will be notified and you're going to need to quickly pay that, as we'll get to here in a second. For hospitals and critical access hospitals, again, recoupment begins after 120 days, but that will continue until 1 year of the advance payment amount that you've been paid. So you're going to have a longer period of time. Obviously, the payments will likely be significantly larger for many hospitals and critical access hospitals, both because you have a longer period upon which you can request the money against 6 months and 100% or 125% of 6 months, and also because you're just going to have a much larger volume of claims most likely. So it's very important to keep track of these dates. Again, 210 days for physicians and 1 year for hospitals and critical access hospitals, because after those 210 days, there's an interest that begins to be charged on the balance if it is not paid off, and the interest rate is 10.25%. Obviously, that's not an interest rate that anybody is interested in paying at all. There has been some questions to CMS if there's any way that they can lower that amount, and the answer from CMS thus far has been that's out of our hands. It's set in law how much the interest rate will be. So hopefully, as Erik had kind of teased, it looks like there's going to be some more, money for PPPs. It looks like there might be another bill coming out for stimulus purposes, and perhaps that's something that Congress will address in their next law. Again, one thing, since payments are tied to MPI, it does seem that personal liability is possible if you fail to repay this money. So it's going to be important for everyone to calendar deadlines to make sure that you make these payments in the right period of time, and also to pay close attention to your payments from Medicare, your remittance advice from coming in from Medicare, to try and keep track of how close you are to paying that off through the recoupment process. All right, Jeff, you can move to the next slide. So kind of getting to the nuts and bolts here of what we're doing here. how to request a payment. You complete the form from WPS or your other Medicare administrative contractor. If you have multiple ones, each one will have a separate form. My understanding is CMS is trying to make these forms a bit more uniform. At first, there was thought you're going to need to put some sort of statement in there. The WPS form does not require you to put any sort of statement as to why you need this money. Instead, you're going to end up clicking some boxes. Regardless, some information that you're going to want to have on hand. Again, this is not real complex, which is a refreshing change of course for healthcare providers. We're not talking about pages and pages of regulations or complex forms like you have to fill out when you're enrolling or making a change of information to Medicare. You really just need your business name, individual MPIs, the addresses associated with those MPIs, and you're going to need to determine how much of a loan you want. Again, you're eligible for, it looks like WPS is paying physicians 80% of the last 3 months. You can request less if you think that's all you need. So, feel free to, go that route and think about carefully how much and strategically, because again, this is going to be recouped from future claims. So your collections in the future are going to end up going down as a result of this, but hopefully it can keep some revenue coming in and you can keep people employed. You're also going to be prepared. You need to be ready to certify that you have no plan to cease doing business, no plan to declare bankruptcy, and that you will use the loans in the ordinary course of business. So kind of, again, the nuts and bolts, payments are made as remittance advice. People have indicated that they're not grouped together with other claims that you're continuing to submit or outstanding claims that are still owed from Medicare. It should be, people are seeing, they request a certain amount and they're seeing something, awfully close to that amount, or within 7 days is the amount of time that is supposed to be paid, although early indications are that Medicare or that MACs are processing this even faster than that. As of a couple of days ago, there had been 25,000 requests for advance payments or applications, and Medicare had paid about 17,000 of those. So what you're going to want to do is keep a close eye on your remittance advice, and again, you're going to also want to be careful to make sure that you're calendaring everything. All right, Jeff, if you want to move to the next slide. So in addition to the advanced CARES, in addition to the advanced payment program, the expansion of that program for hospitals and physicians, the CARES Act also included $100 billion to a pre-existing emergency fund for providers. Not sure how many of you have looked at all of the CARES Act. I'm sure Erik has reviewed most, if not all of it. But it's over 800 pages, almost 900 pages long. If you look on page 750 to 752, you will see the provisions about the emergency fund. So $100 billion fund, and there's 3 pages of text providing us some insight into how this will be doled out and how people can apply for it. And which is to say, there are not many details, particularly considering how much money is involved. So it's a little difficult to answer too many specific questions. Over the last few days, we've seen some proposals from entities like the American Hospital Association. We've had some additional guidance from Seema Verma, who's in charge of CMS, regarding how they intend to distribute some of these funds. But we'll give you the details that we can on this, and we'll continue to monitor these developments. So eligible healthcare providers include Medicare enrolled hospitals, physicians, and suppliers that provide care for individuals with possible or actual cases of COVID-19. So I think there was an initial thought that maybe this would be an option for people that are just losing revenues because they've had to shut down as a result of this. And I think that's going to be true to some extent, but it's important that this is going to have to be tied to treating people with possible or actual cases of COVID-19. So I do think some people are unlikely to get that money, although as we'll talk about in a second here with the proposal from Seema Verma, it seems that the government might be applying this pretty broadly and sending this to people without kind of taking that granular look at who is or is not providing care for COVID-19 patients. The grants can be used for related expenses or lost revenues attributable to coronavirus. Again, the nice thing about the funds from the emergency fund is that unlike the advance payments, this is not a loan or a cash advance. These are grants, and you're not going to have to pay this money back. So, which is one of the reasons why this is quite appealing to providers. I should have mentioned at the beginning of this, the idea behind the emergency fund and this additional money is that, and I'm sure many of you have seen the headlines and many of you are experiencing this very firsthand, is that there was providers, especially those in areas that haven't been particularly hard hit, are just losing, millions of dollars every week as a result of no longer being able to do elective procedures. Governor Whitmer had issued an executive order that prevents a whole, basically anything that is not going to be saving someone's life should be delayed, and that has resulted in the delay or cancellation of any number of procedures that are really the lifeline for most hospitals and physicians. And as a result, the idea behind this is to help people, healthcare providers survive this delay, recognizing that they're kind of doing this for the greater good and to be prepared for any influx of patients. So again, the grants can be used for related expenses or lost revenues attributable to coronavirus. And I think in particular, the lost revenues is something that people are experiencing and hoping that the government can help out with. It can be used for, building or construction, leasing properties, medical supplies and equipment, PPE and testing, training, and surge capacity. Also, one of the significant provisions, again, there's not a lot within the bill itself, discusses that documentation will be needed to be provided, and the reports will be needed to be made to HHS for those receiving funds. So it's important to start your documentation now. Look at last year, look at the prior month to determine how much loss of revenue, what do you usually see in patients, what have you seen in patients now, and determine what other steps you've taken to train staff. If you're people are switching to telemedicine, so it's possible that those expenses will be reimbursable through this fund, as well as, training and things like that. All right, Jeff, you can switch to the next slide. Again, there's lots of uncertainty regarding this fund. There has been some indication from the administration that a portion of the money from this $100 billion fund will be used to pay for the care of uninsured individuals. The estimates could be as high as $40 billion of that $100 billion fund. So again, it'll be interesting to see exactly how this plays out. No one's 100% certain. As I had previously referenced, the American Hospital Association had issued a proposal to pay hospitals between $25,000 to $30,000 per bed in order to help them offset the loss of revenues and to help reimburse them for all the expenses incurred as a result of responding to this worldwide pandemic. Just a couple of days ago, CMS issued a statement indicating that they're going to send out $30 billion this week. This is going to be based on Medicare revenue. It's not going to be a first-come, first-served basis. The bill itself made a rather vague reference to hospitals or healthcare providers, eligible healthcare entities applying for these funds, and including a statement as to why they need that amount of money, why they need some of this money. And it appears that while that's true, that's one way, and we're advising clients to submit those applications and request money from that, it looks as if the government is going to take some control over this fund and just use this money to reimburse healthcare providers in some way. Again, it looks like the first one is going to go out this week. It's not exactly clear, although some people seem to think that this will really be aimed at hospitals who are bearing the brunt of the responding to the COVID-19 pandemic, but that is not 100% clear. Seema Verma did say that there will be a second tranche of this fund to pay to other providers who may not have a lot of Medicare patients. She specifically mentions, for example, OBs. So it looks like there's going to be an initial help for Medicare providers, and then hopefully another, group of funding or another tranche of funding that goes out to other providers as well who have, experienced a loss of revenue or incurred additional expenses as a result of that. One kind of hope for some clarity is that the bill requires HHS to report to Congress in 60 days. And there's some people seem to think, although it's not exactly clear to me, some people seem to think that these that will result in some regulations or additional clarification from HHS regarding how this money will be used. But so we'll see. Hopefully we do get some guidance from HHS within the next 60 days, and then we can all join again for another fun webinar. So one thing, I've gotten a few different questions on this. The one question is, do dentists qualify for help? The answer is, if you're billing Medicare, I guess so for the advanced Medicare payments, the answer for that was clearly yes. It's less clear to me if entities that are not providing any care to COVID patients are going to get any money for the emergency fund. My interpretation of that is no. I believe that the exact language within the bill with respect to who's an eligible entity does say, that provides care or testing for patients with COVID or potentially have COVID-19. So that's language I interpret to mean it's not likely that people, like dentists or podiatrists or other providers are going to get some of this money. But at the same time, Seema Verma had mentioned sending this out based on Medicare and then sending another tranche out. And it doesn't seem that they're issuing this with like pinpoint accuracy. Another question, are you eligible for the emergency fund if you have a PPP loan? The answer is yes. With respect to this emergency fund loan, there is language again in the bill that says, you can't use this money to pay for expenses or obligations that someone else is supposed to pay for, or where someone else has an obligation. I don't interpret that to prohibit the use of PPP. Again, the emergency fund is available for any number of things, construction, training, as opposed to PPP, which is primarily aimed at payroll. So again, I don't think that you disqualify yourself by kind of applying for several of these different programs, and I've encouraged clients to do so. All right, Jeff, you can.
Tim, I agree. This is Erik. Tim, this is Erik. Just on that point, there's nothing in the Paycheck Protection Program that would disqualify you from that program based on anything you're covering, just to confirm.
All right, thanks, Erik. Yeah, so that answered the other question here. Are you eligible for the Medicare Advanced Payment Program, even if you have a PP loan? And so, again, as you just heard, Erik, the PPP does not prohibit that, and the Medicare Advanced Payment Program does not prohibit that either. Other CARES Act provisions, I'm going to go over these quite quickly. For those that have been, who do a lot of Medicare work in particular, CMS has issued a whole host of waivers, and then they've issued blanket waivers and also state-specific waivers for here in Michigan. One of the big early things that people were paying attention to was telehealth expansion, and there's a number of kind of loops or loopholes or kind of gaps in some of these expansions, and the CARES Act helped to fulfill some of those. So they made it clear that federally qualified health clinics can use telehealth and bill for telehealth services. Dialysis centers can as well. A lot of the dialysis requirements require face-to-face, and similar with hospice and home care and other services that require face-to-face. A lot of those, the majority of them, have been relaxed so that those services can now be provided via telehealth. The other thing is the initial waiver from CMS with respect to telehealth. The way the Congress had written the initial bill required a prior relationship with a patient, at least within the last 3 years. And CMS had said, don't worry about that, we're not going to enforce it. And the CARES Act really kind of filled in that gap and said, you don't need a prior relationship. There's also some grant money to expand and improve rural telemedicine coverage. There is coverage. The bill also provided coverage for COVID-19. All lab tests are covered. Private plans are going to be required to reimburse these things. Services that result in COVID testing and screening are also required to be covered as well. And Medicare and Medicaid are going to cover these for sure. Add-on payments for hospital COVID treatments there's an additional reimbursement for hospitals that are providing COVID treatments. And there's also, importantly, liability protection for volunteers that was included. There's also, for those who have been paying attention to the government's or the executive orders here in Michigan, there's liability protection provided in, I think it's 2020-30 executive order, and there's also other state laws that provide for that as well. All right, so I'm getting some additional questions in here. While the PPP program would not disqualify someone from applying for or receiving the emergency fund, I would think that if you use those funds for things that are covered under the PPP, it would reduce the amount that may be forgiven. Erik, if you want to go ahead and field that one.
Yeah, sure. I agree. You want to be careful how you use the funds from different programs. So if you're a PPP borrower, you want to make sure that in order to maximize the forgiveness of that loan, that you use those funds from the PPP loan for those forgivable expenses, which are, again, at least 75% payroll costs and 25% for up to 25%, could be less, for mortgage interest payments, rent, and utility payments. So yes, you want to be careful to tie the use of the PPP loan funds carefully to those forgivable expenses, and be careful not to kind of commingle the funds, because if you're a PPP loan participant, it's very important to establish that connection between the receipt of the loan from the SBA approved lender and then how you use the funds so that you can ultimately obtain forgiveness. That's a very good point of emphasis there.
Yeah, I agree. From the emergency fund perspective, you're going to want to have good documentation, and as the bill says, you're going to have to submit documentation and reports to support your expenditures and your need for the loan. So again, I agree with Erik that from the emergency fund documentation and what funds you're using for what expenses will be quite important. Another question that I'm getting are, may physical therapists and occupational therapists perform services via telehealth? I don't believe so at this point. I will double check. I think one thing to consider is to pursue maybe a state waiver. There's a process where you can seek, it's called an 1135 waiver from CMS. I would also encourage you to reach out to private payers. One of the problems in discussing some of these, especially reimbursement type issues, is that while Medicare and Medicaid have issued some guidance, each private payer, Blue Cross, HAP, or United Healthcare, Priority Health, approach these things differently and have different rules regarding what they will and will not pay. So I encourage you to reach out to your payers. And I mean, frankly, I think it would make sense, particularly here in Michigan, for those services to be able to provide telehealth. And so perhaps CMS would be willing to grant a waiver to the extent that those are not currently eligible for reimbursement. All right, Jeff, you can switch to the next slide. And one more quick question here, because it's on the emergency fund, indicates we're planning on setting up a separate facility for evaluating sick patients, including potential COVID-19 cases. Look like the emergency fund could be useful for costs associated with the build-out equipment. Do you agree? Yes, I definitely agree, and I'll also address another possible funding source for that in a minute here. So one thing that some providers have might be able to think creatively about options for kind of regaining some of the revenue that they've lost as a result of the being shut down for COVID-19 treatment. CMS has issued a number of blanket and state-specific waivers. Again, so ramping up telehealth is an option. Again, people are hopefully already aware of this, but you can use FaceTime, Zoom, Skype, or other digital platforms that you usually are not allowed to use because they're not considered HIPAA compliant. So consider that as one option. Options in heavily hit areas is CMS has said ambulatory surgery centers can bill as hospitals. You can rent offices to hospitals. There's stark restrictions with respect to like fair market value, recognizing that there might need to be an additional pay for hazard type pay has been increased. So, places like Detroit and New York are looking for additional staff to help out. So those are ways for providers who are kind of sidelined by this. If you have the qualifications to provide care, that might be something you want to consider looking into. All right, Jeff, next slide. Again, other business considerations. This is sort of what I teased here a minute ago. FEMA funds are something that healthcare providers might be able to look into. Importantly, unlike some of these other provisions which don't make, the advance payments or the emergency fund, which don't discriminate between nonprofit and profit entities, only nonprofit entities are eligible for FEMA funds, and you must provide eligible services. This is a call for healthcare providers. So you're going to be eligible. The majority of people on this call who are nonprofits are going to be eligible for this, clinics, nursing homes, obviously hospitals as well. The reimbursement, the funds can be used for eligible emergency protective measures. They can't be costs that can be covered by other sources like CMS. So I think, issues, so bills for providing care are obviously not going to be eligible for FEMA funds, but things like training, disinfection of public facilities, emergency medical care where, there's no payer that's required to pay for them, building facilities, which was one of the questions we just had, purchasing PPE and tests and prescriptions. Again, we're dealing with a number of different potential sources. And as Erik had mentioned, it's going to be important to kind of document what sources are being used to pay what expenses and to avoid kind of running afoul of any of the requirements for these various programs. Public health and safety communications, a lot of providers are, sending out emails for, to people and or, kind of issuing public safety advisories. And so that might be something else that people are eligible for. So that one can be applied using a FEMA portal. They have a portal and there's an application available on there. I'm not going to tell you all that I'm an expert on FEMA funds, but I did in the course of talking about various funding opportunities and funds available to healthcare providers, I did want to mention that FEMA funds might be something that people want to look into. I know I have at least one client who is working with an entity that has, the counsels and provides guidance and consults with people with respect to that. So that's an option to look into, and certainly something that we're trying to ramp up on here at Miller Johnson as well. A question that I just received, can you repeat how small medical offices can apply for the grant money in the emergency fund? Again, it's not exactly clear on the emergency fund how the money, they just refer to an application to HHS. So you would send, basically it would just be kind of your own form where you would state that, we need this funds, we need this money as a result of being shut down due to COVID-19. We're no longer able to perform services, or we had to provide our staff additional training, or kind of all of those things combined. And you would request an amount of money in addition to kind of making those statements about why you need the money. So again, there's no form at this point, and I think a lot of the money is just going to be distributed sort of by CMS, irrespective of applications, but that would be how you would go about kind of getting in line or attempting to get some of those funds. All right, Erik, or sorry, Jeff, if you want to switch to the next slide. I think that covers everything. You see the contact information for me, Tim Gutwald, and my partner, Erik Daly. We encourage you guys to reach out to us with respect to any specific questions, and we'll do our best to answer those. There's a couple questions kind of sitting out there for, and I'll get back to the question about physical therapy and occupational therapists. I'll reach back out to you to confirm whether or not telemedicine is an option. We greatly appreciate people everybody for joining these and kind of coming together as a community to help address and work together to keep people safe and to weather this storm that is this COVID-19 pandemic. You can see there's a link through the chat to the webinar and PowerPoints and recordings that you can all find on our Miller Johnson COVID-19 webpage. And also want to remind everyone that tomorrow we'll have another webinar on estate planning action items, what you can do now in light of this pandemic. So again, we appreciate everybody who called in and listened in, and stay safe.
Thank you, everybody. Have a good day.